Welcome to our video on tackling obesity in Australia. Let's dive into the challenges and solutions. We'll explore the growing challenge of obesity in Australia, the factors contributing to it, and the initiatives Australia has taken to combat it. Let's dive in. Obesity is a significant public health issue in Australia. It's defined as an excessive accumulation of body fat that increases health risks, measured using the body mass index, or BMI. A BMI of 30 or higher is classified as obese. In Australia, 2/3 of adults are overweight or obese, and 1 in 4 children is affected. These numbers continue to rise, contributing to health complications like heart disease, type 2 diabetes, and certain cancers. Obesity in Australia is driven by several factors. Dietary habits. Australians consume a high amount of processed and fast foods. Sugary drinks and calorie-dense snacks are a common part of daily diets. Sedentary lifestyles. Modern lifestyles with excessive screen time, long working hours, and limited physical activity contribute significantly. Socioeconomic inequalities. People in rural and remote areas have limited access to fresh produce and recreational facilities. Low-income households often choose cheaper, unhealthy options due to financial constraints. Aggressive food marketing, junk food advertisements often targeted at children play a significant role in shaping unhealthy eating habits. Cultural norms. Social gatherings often involve barbecues, alcohol, and calorie-rich foods, making healthy choices less appealing. Obesity is a major risk factor for cardiovascular diseases such as heart attacks and strokes. Type 2 diabetes affecting millions of Australians, certain cancers including breast and colorectal cancer, joint problems such as osteoarthritis, mental health challenges including depression and anxiety. Obesity-related diseases are among the leading causes of preventable deaths in Australia. Acknowledging the severity of the issue, Australia has implemented several strategies. First, let's talk about the National Obesity Strategy 2022-2032. This is a 10-year plan focused on preventing and reducing obesity by creating supportive environments and encouraging healthy living. Then there's the Live Lighter campaign, a public awareness campaign promoting healthy eating, physical activity, and the dangers of sugary drinks. In South Australia, junk food advertising restrictions are making waves. Starting in 2025, junk food ads will be banned on public transport, and there's a push for a nationwide ban. Schools are also playing their part by actively teaching children about nutrition and incorporating physical activity into their daily routines. Community initiatives are another key component. Local governments and organizations are organizing fitness programs, cooking workshops, and health checkups to engage communities. Obesity is a global issue, but approaches differ across countries. In the United States, for example, obesity rates are higher. However, they've introduced calorie labeling on menus and taxes on sugary drinks in some states. Japan and South Korea maintain low obesity rates due to traditional diets rich in vegetables, lean proteins, and portion control. Cultural norms in these countries encourage mindful eating and daily physical activity. European countries like the Netherlands and Denmark invest heavily in urban planning, promoting walkable cities and cycling infrastructure to encourage active lifestyles. Developing nations such as India and Brazil face a dual burden of obesity and malnutrition as traditional diets are replaced by processed foods. In the Middle East, high obesity rates are linked to diets rich in carbohydrates and fats, combined with limited physical activity due to extreme weather conditions. Australia is leading research on obesity prevention. Studies emphasize the importance of tackling childhood obesity to prevent adult-related diseases. Community-level interventions combining fitness and nutrition education are showing promising results. Emerging research on gut microbiota highlights its role in managing obesity through dietary changes and probiotics. Preventing obesity requires a multi-level approach. Healthy eating, reduce processed foods and sugary drinks, and focus on whole foods and balanced diets. Regular exercise. Aim for at least 30 minutes of physical activity daily. Community support. Engage in local health programs and fitness initiatives. Public policies. Advocate for urban designs that promote walking, cycling, and recreational spaces. Mindful eating. Practice portion control and avoid emotional eating. Obesity is a complex challenge, but it's one we can tackle together. Australia's initiatives, combined with lessons learned from global successes, pave the way for a healthier future. By promoting healthier environments and encouraging individual efforts, we can combat obesity and improve the well-being of our communities. Take the first step to a healthier you. National Obesity Strategy, 2022 to 2032, https://www.health.gov.au/resources/publication/national-obesity-strategy-2022-2032, Obesity Evidence Hub, https://www.obesityevidencehub.org.au Australian Institute of Health and Welfare, https://www.aiw.gov.au/report/overweight-obesity. Thank you for watching and subscribe to our channel for more videos about health-related topics.